I am not a golfer, but why was this hanging over my desk all through medical school? Well, for starters, I went to school in Center City, Philadelphia, and my apartment was tiny, and my desk was in a closet. And I thought this added a pop of color. But also, I was inspired by the simplicity of a singular goal. And don't tell my husband and my father, but golf is simple, right? I mean, you just have to get the ball in the hole. So I reached my one goal, and I graduated medical school, and I went out into the real world of healthcare, and this is what I found. This is healthcare. It's messy, and it's complicated, and it's not always safe. I mean, what are the rules of this game? And who is winning? But then I saw past that chaos, and I saw these 4 holes. And in healthcare, we call this the Quadruplane, and it's what every leading health system is after. First, we want to deliver high-quality care, care that's effective, care that is evidence-based, care that is safe, care that is equitable. Second, we want our patients to have a seamless and satisfying experience as they go through this landscape. Third, we want our healthcare workers to find joy and meaning in their work so that they show up day after day to deliver this care. And finally, we need to cut costs. We spend too much money on healthcare, and it's just not sustainable. We spend a lot of time trying to figure out how we're doing, right? How do we measure up? Our heads are swirling in the data. We look at patient satisfaction surveys and employee satisfaction surveys, colonoscopy rates, admission rates, readmission rates, profit and loss statements. It's a lot. And I keep going back to that one singular goal. What if there was one thing we could measure that signaled our success? There is. Continuity. So continuity is that longitudinal and trusted relationship between patient and doctor, or between patient and care team. And it turns out you can measure this. So if patient Ann goes to the doctor 4 times this year, and 3 of those times are with her doctor, that's a continuity rate of 75%. That's pretty good. And when you look at the communities throughout our country, and you look at the communities with high continuity rates, guess what you find? 4 things. You find better health outcomes, you find happier patients, you find happier healthcare workers at lower costs. And actually, the people who live in those communities, they live longer. It's better healthcare. So what gets in the way of continuity? This. So about a month ago, I wanted to recreate a particularly delicious drink I had imbibed called the Paloma. And the key ingredient in a Paloma is freshly squeezed grapefruit juice. So I went on Amazon and I ordered this, and it was at my door in less than 5 hours, just in time for happy hour. And in healthcare, we call this access. And we humans crave access, right? I mean, we want what we want when we want it. And we've come to expect this level of service in almost every industry. Think of all the things you can have to your front door in hours or even minutes. So what's tricky about healthcare? You see, in healthcare, access and continuity are inversely proportional. You have to give up one to get the other. So if you're sick today and you want to see a doctor, you probably can, but it won't be your doctor. And if you want to see your doctor and your care team who knows you, you can, but you might have to wait 3 days, 3 weeks, maybe 3 months. So the other day I was walking my dog, and I got a text from a friend of a friend of a friend's neighbor And she sent me a picture of a rash on a body part she probably shouldn't have texted me. And she said, "What do I do with this rash?" And I said, "Well, what did your doctor say?" And she said, "Oh, he doesn't have time for this." Right? So what kind of healthcare system are we living in where doctors don't have time to take care of patients? We need both continuity and access together, right? We deserve that. So how do we get there? This is the digital transformation of healthcare. This is virtual care. Virtual care is that sweet spot between that longitudinal, continuous relationship and that radical convenience. Raise your hand if in the last 18 months you've had a video visit. Most of us, right? So in April of 2020, almost half of primary care visits in this country were done virtually in the Medicare population, 65 and older. And that rate right before the pandemic was 0.1%. So the Jetsons saw this coming 60 years ago, right? And we've all been catapulted into this world, and we've done pretty well. But I have to say, as a physician, what I was most surprised about with video visits was how much closer it brought me to my patients. I mean, all of a sudden, I was in their living room. I was meeting their pets and seeing their grandchildren's artwork. On one occasion, I was at a 10 a.m. video visit with a patient of mine, and her husband, also my patient, was intoxicated in the background. And on another time, I was having a video visit with a patient of mine who took his video from his recliner, where he told me he'd been sleeping for 2 months because he could no longer make it up the stairs. I learned things about my patients I never would have known without going into their home. I felt like Doc Baker, making house calls, right? Only I didn't need to rely on a horse and buggy. I used technology, and I could see many patients, many miles and states apart, all in the same day. So video visits are an important part of virtual care, but they're not the only part. There's something called asynchronous care. And where I work at the Christiana Care Center for Virtual Health, most of the care we deliver is asynchronous. It's outside the context of a planned visit. It's texting and emailing. You know, primary care has become so transactional, and the currency is 20-minute office visits. About 15 years ago, when I came to Christiana Care, I taught a workshop called Negotiating the Agenda. And I taught this to medical students and residents. And the idea was that every good primary care provider walks into that room with an agenda, right? They need to do chronic care and preventative care and wellness care. There's a lot they're thinking about for that patient. But you know what? The patient has her own agenda. Sometimes I learned it's in the form of a 3-page typed list. It's all the things, all the questions and concerns she's been saving up since the last time she saw me 6 to 12 months ago. This is high-intensity, low-frequency care. And we need the reverse. We need high-frequency, low-intensity care. It's those touches every few weeks, right? We need to stay connected to our patients. So I can't give a talk on virtual care without showing the toys. I recently read an article in the Harvard Business Review that said innovative technology is less about the technology, it's more about the talent. And I think that's true. But I do think these are important tools in our toolbox. So these are devices that patients wear or use at home to help us track their health. It's blood pressure, pulse, heart rate, heart rhythm even. And what it does is it gives us much more information on which we can base clinical decisions. So instead of one blood pressure reading and one 20-minute visit, we now have many data points to make a better informed decision. But what I like even more about this is that it belongs to the patient. And the patient now owns this and is engaged in their own care. and can keep up with their own health right at home. I want to close by introducing you to Jorge. So Jorge is a 63-year-old man. He lives in Wilmington, Delaware. And at the beginning of the pandemic, Jorge had a heart attack. And he went to the hospital where he received excellent transactional care. And he was sent home with medications for his newly diagnosed diabetes and high blood pressure and high cholesterol. Only when he got home, he was lost. He didn't have continuity with any care team. He couldn't afford those medications. He didn't know what to do. So he didn't do anything. Months later, Jorge fell ill. And instead of going back to the hospital this time, he went to his local community center where he plays bingo. And there, our Center for Virtual Health was offering virtual care. Now, Jorge came in because he thought his symptoms were due to COVID and he wanted a test. And thankfully, his test was negative, but what the team found that day was that his sugars were dangerously high. And they weren't just high that day. You see, they did a test called a hemoglobin A1C, and it measures the average blood sugar over the last 3 months. The goal for most diabetics is less than 7, and Jorge's A1C that day was 10.3. He was at grave danger of developing another heart attack, or a stroke, or even death. So our virtual care team wrapped their arms around him. They connected him to care. They brought in a virtual Spanish translator. They brought in a provider virtually. They found him medications that he could afford and a pill box to organize his medications. They met with Jorge and his daughter to go over a diabetic diet that was able to be used in his Mexican cuisine. And the nurse on the team, she checked in with Jorge and his daughter every few days to titrate his medications according to his sugars. It was high frequency, low intensity care. So last week marked Jorge's 3rd month with our care team, and it was time to repeat that A1C. And this time, instead of 10.3, Jorge's A1C was 6.2. Today, Jorge's future looks bright. He's feeling great. He's taking his medications. And most importantly, he's connected to an amazing virtual care team. Thank you.